Hello, everyone, and welcome to today's webinar. Thank you so much for joining us. My name is Colleen Healy-Boufides, and I'm a senior staff attorney with the Public Health Law Center. For those who aren't familiar with PHLC, we are located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. The Public Health Law Center is a national nonprofit, and we have partnered with the New York State Department of Health to support commercial tobacco control professionals and advocates in their work to end the commercial tobacco epidemic in the state. Our New York focused team is the Center of Excellence in Tobacco Policy. And while today's webinar is designed specifically for our New York tobacco control colleagues, I'm sure it will interest others as well, and I'm glad to have many states represented on the webinar today. I'd like to start out acknowledging our presence at PHLC in the tribal and treaty homelands of the Dakota people, part of the larger Sioux Nation, and further acknowledge that 4 federally recognized Dakota tribal nations remain in this area. We appreciate that in these tribal lands, Indigenous peoples have joined together in community, stewardship, and spirituality, upholding traditional values and legal principles. I want to also acknowledge the diverse tribal communities throughout New York State, including 8 federally recognized tribal nations. PHLC works with tribal communities throughout the country to support their efforts to restore traditional lifeways and health through law and policy. The Public Health Law Center provides free legal technical assistance to communities, public health advocates, and other partners, and we publish and present on commercial tobacco control topics. Hopefully many of you in New York have worked with us directly at this point, and if you haven't, I'd encourage you to reach out with questions or to set up a time to chat. At PHLC, we also have teams working on healthy eating and active living, climate justice, and public health infrastructure. We do not provide direct client representation, nor do we lobby. Today's presentation should not be considered legal advice, and we always encourage you to consult with your own legal counsel. In all of our work at PHLC, we are committed to advancing health equity. Laws and policies have contributed to significant disparities by failing to protect and often actively harming groups who are socially and economically marginalized. As law and policy professionals, we strive to center equity across our work in support of policy change that leads towards a more just and equitable world. Health equity is closely tied to social determinants of health, which are external, non-medical factors that contribute to health outcomes and quality of life. These factors can be influenced through law and policy and are central to advancing health equity. Just a quick note about terminology. PHLC uses the term commercial tobacco to mean industrial scale commercial tobacco production. We want to emphasize the harmful and addictive products created by the tobacco industry. We are not referring to traditional tobacco, as it is used religiously, medicinally, and ceremoniously in many different indigenous cultures. So when we use the phrase tobacco, we mean commercial tobacco, not traditional or the sacred use of tobacco. Now I'd like to introduce our speaker for today. I am so delighted to have my colleague Dawn Hunter with us to speak about public health advocacy strategies. Dawn is the founder and CEO of the Dawn Lab, a boutique consulting firm dedicated to transforming policies and practices to support well-being at work and in life. Dawn collaborates with public health agencies, community-based organizations, and academic institutions to create innovative solutions that operationalize health equity and foster community power building. Her work includes research and analysis of legal and public health data impacting health equity, facilitation of capacity building workshops, and training on a range of public health topics, including advocacy, ethics, and values-based messaging. Dawn calls New Mexico home and currently lives in the Tampa Bay, Florida area. She holds an AB in English Literature from Princeton University, a BS in Microbiology, and an MPH in Global Communicable Disease from the University of South Florida, and a JD from Stetson University College of Law. She is certified in public health by the National Board of Public Health Examiners and is a licensed member of the Florida Bar. Dawn is an award-winning public health expert and a wonderful colleague, and we are so happy to have her here today. And with that, I'll turn it over to Dawn.
Thank you so much, Colleen. Well, hello, everyone. I am really excited to be here with you today. And while I put this into presentation mode, Want to thank Colleen and the Public Health Law Center for this opportunity. This is a topic that I'm incredibly passionate about, and I'm excited to share with you what I know and have learned and have practiced based on research and real world experience. And so, again, today's webinar is Strategies for Policy Advocacy in a Shifting Public Health World. One thing I will say is that there are points at which I will ask you to engage in the chat and look forward to hearing your thoughts on some of the things that I'll be sharing. Our objectives today are to identify some key strategies for framing tobacco prevention and control policies using a health equity lens, which I will talk about more. Applying values-based messaging approaches that emphasize connection, trust, and care to engage diverse stakeholders in shifting political climates. This is something that is on all of our minds and is frequent question that I get. And then developing practical advocacy tactics for communicating effectively and relationally about policies such as smoke-free housing, retail licensing, tobacco-free outdoors, and tobacco waste reduction. So this is the first point at which I'm going to ask you to engage in the chat. This is a photo that I took in 2020 in North Carolina, and I stopped wherever I was walking, and I hadn't seen this particular campaign before and thought it was really clever. And it was clever to me because it plays on an existing public health phrase that we all know, which is practicing safe sex, and then a play on words with masking for a friend. And I think it's a great example of how you can do something that's catchy that helps people to adopt a certain behavior or approach. So think about a public health campaign that was memorable to you. What was that campaign and what made it memorable? And I'll give folks a moment to place ideas in the chat about something that stood out to you. You could just say the name of the campaign. You could share why it was something that you remember. And then I'm going to share a couple of examples with you. We have an example, the We Buckle Safe Driving campaign in Minnesota. Thank you for sharing that example. I like it because it says we, and being able to see yourselves as part of a group that is doing a thing is an important part of messaging, which we'll talk about more today. Any other thoughts or examples? Keep the Party Safe overdose prevention campaign presented harm reduction, naloxone education in a really destigmatizing way. Nice. I love that keep the party safe phrasing too, because it appeals to something that we all value, our safety, and recognizes that this is a space where people are going to engage in this behavior. You know, how do we make it sure that people are protected? Click it or ticket for seatbelt billboards. Another, I think there are 2 click it or tickets. Yep. 3 click it or tickets. It's a popular choice. Got milk. Yes, that's a very popular ad campaign. And in fact, I saw a play on that one as well. I was in DC on the back of a bus. There was it was an ad for getting tested for syphilis anyways, and it said got syphilis. And I have a picture of that somewhere. And that one is, its head again ties to an existing public health campaign that we know, but it was specific to a problem in that particular community. Toss No Mas, New Mexico's Clean Environment campaign. Tips from former smokers, love that example. The It Can Wait campaign to prevent texting while driving. Yes, that's one. I would love to see the data on how effective that is. Because I think that's a more recent campaign. I'm not sure the data on that, but that's a good one. And it's not just campaign about menthol tobacco marketing. So these are all great examples. Feel free to share more in the chat, but what I wanted to share are these examples, which we all may know, which is This Is Your Brain on Drugs. Usually somebody shares this one. That's on the left side. This is your brain on drugs. Any questions? We all remember that ad, I hope. There's another one. Yeah, crack is whack. That was part of the drug war and, you know, probably problematic language, but it drove a lot of policy. Do you know your lemons? Breast cancer awareness campaign. Of course, October is Breast Cancer Awareness Month, and this is a popular and well-known campaign that helps to understand the changes in your breast that might be indicative of something that is cancerous. And then somebody mentioned tips from former smokers, and again, that is also a very important and memorable campaign. That is also very effective, and I'll talk about that in a moment. So what I'd like to share is this one, and then I'm going to ask you a question. This is a short and very old tobacco ad, anti-tobacco ad. Did I, could people hear that?
Yes, we could hear that,
Okay,
Dawn.
good. I was like, did I click share sound?
Sometimes you just lose alone. Or you don't always die from tobacco. Sometimes they just snip out your tongue. And you won't sing worth a heck with a big hole in your neck. 'Cause you don't always die from tobacco.
All right, what I'd like to ask you is, what do you think stands out about this particular ad to you, why it might be memorable? Let me see if I can open the chat again. Catchy tune. Yes, the robotic voice. Yeah. It's out of the norm, the device he uses to speak. He looks like he might be or have been in his life the Marlboro Man. Yeah, shock value, that's an important one. The song lyrics and beat, scary, real people. Yes, both of those things are really important, and I'll talk about why. All of it is memorable, in my opinion. Robotic voice, the shock value of the lyrics. Right, so we see the faces of the people in the crowd, and at the end, it's a very quick point, but it shows the asterisk, and the asterisk says, knowledge is power. And that's important from a communications perspective. And here's another short example, and that is effective, which I mentioned, and I'll play it.
Smoking gave me gum disease, and I lost all my teeth. Here's my tip. You might think quitting feels like pulling teeth. Trust me, it's not even close.
You can quit. For free help, visit cdc.gov/tips.
Now, that one is important because it's a personal story from a real person who is affected. It has a specific health impact. Oh, I should have fixed that. It's not throat cancer. Although there is an example of this campaign with throat cancer. This is tooth loss. And it's empathetic and human, and it ends with a very clear call to action, and it does it very succinctly, right? So it hits our attention spans. It's interesting. It's powerful to see the imagery of removing the teeth, right? And so these are all things that appeal to everything that makes a difference when we think about messaging and communication. And now that we've walked through what makes communication stand out, I want to take a moment to talk about the current context, which is one of our objectives here today. And I want to give credit to Jean Matthews, who is my former supervisor and someone who is a legend, I think, in the public health world, but he was the chief legal officer at the CDC for a whole career, more than 20 years. And he was actually in that role when the AIDS pandemic happens. And one of the things that he shares is this chart showing culture variations in cohesive culture versus divided culture, and the things that unite us and the things that can divide us. So the polio vaccine was a big deal. There was a lot of unity around this issue that was really heavily impacting people before the vaccine, right? And had long-term consequences, health consequences. And then contrast that with the AIDS pandemic, where there was a lot of division and there was a lot of skepticism and distrust and mistrust. The terrorist attacks of 2001 were something that were very unifying nationally, but then we have something like COVID in 2020 that was very divisive. These are all important to understand, that we are going to swing through these cultural moments, that we are in one of those cultural moments where we are divided. Eventually, there is something that will unite us. And I think what that tells us is that we have opportunity. And the other important thing that Gene points out when he shares this particular slide is that one of the things that people say is, I've never experienced something like this in my lifetime. We all said that, for those of us who remember experiencing, who remember 9/11 and were old enough to remember that. For people who had people who were affected by polio or HIV and AIDS, right? We all would say something like, I've never experienced something like this, but we have historically experienced this collectively, and things will change. One thing that's not on this timeline that is really important in this tobacco context is 1994, the Waxman hearings, where 7 tobacco CEOs or top tobacco executives testified. This ultimately led to the 1998 Master Settlement Agreement, which of course is an important source of funding and support for current tobacco prevention initiatives, along with other health initiatives, because of course states have some discretion over how some of that money is spent. Another important piece of context is understanding negativity bias. And negativity, I love this comic by Heart and Brain. This is one of my favorite comics, but Heart is standing there and he says, Brain, look, and there's a pile of good things, all good things with a butterfly on top. And then on the right, Brain says, not now, can't you see I'm busy? And he's looking at the one bad thing. And I like this because I feel like this is negativity bias in a nutshell. And that is that negativity bias causes people to focus more on and remember negative information and events. And it's a trait that is amplified by the news media's tendency to prioritize the negative and prioritize negative stories, which in turn increases our belief that the world is more negative than it actually is. And this is incredibly problematic in today's online environment, which consistently and constantly reinforces that bias for us. Another important bias that I often talk about, if not always talk about, is confirmation bias. And this is an article by Jonathan Haidt, who is the author of The Righteous Mind. And the article title is Why the Past 10 Years of American Life Have Been Uniquely Stupid. It's Not Just a Phase. And in this article, he talks about confirmation bias, which is the tendency to give greater attention to information that is consistent with what we already believe. So as an example, if you didn't believe that people were dying for COVID, you are going to find a research that says that people were not dying from COVID. So this article talks about this bias and how it's incredibly problematic in today's social media environment, much like with negativity bias. And that's because it is much easier today to find people and ideas who are aligned with your perspective more than ever before. And that is dangerous because when we are constantly reinforced and when we don't interact with those alternative perspectives, we run the risk of engaging in something called groupthink. And groupthink is this phenomenon of conforming with a group or the consensus view rather than engaging in your own critical thinking. And it's often done as a way to preserve group harmony. And from a policy perspective, this is incredibly important because group-based bias is a way that people make policy decisions that are aligned with their in-group more so than their individual preferences. This is a huge driver of the way that policy is thought about by individuals, by how it affects their group. One of the things that Haidt says in this article, though, is that the most reliable cure for confirmation bias is interaction with people who don't share your beliefs. He also says it this way in his book, The Righteous Mind. The main way that we change our minds on moral issues is by interacting with other people. So I like to start here with this understanding like what makes communication stand out, and then understanding the context in which communication is currently occurring, and then talk about these biases, because it's really important that we recognize our own strengths and gaps as individuals and as public health professionals and the organizations that we work for when it comes to connecting with alternative viewpoints. So one thing you can do today is ask yourself, how much am I interacting with people who I don't share beliefs with? How much is my organization engaging with alternative viewpoints? Is there opportunity for myself as an individual in my community, as a professional in the public health space, or within my organization to create these opportunities for conversation? So I want to play this video. I'm only going to play a couple of minutes of it, but this I think beautifully sums up what I have been trying to describe and helps to put this in the context of how we apply a health equity lens, which is looking at systems and structures that create inequities and the ways that dominant narratives or worldviews can reinforce those systems and structures. This is a resource called Narratives for Health Equity by Health in Partnership.
Even before our first breath, those anticipating our arrival begin to draw the outline of our lives. We enter the world as blank canvases, friends and family lovingly imprinting their most sacred stories into us. But the stories of loved ones aren't the only ones that shape us. We're also influenced by stories and beliefs passed down from historical systems of oppression, telling us how the world works and our role within it. Many of these beliefs go unquestioned and unnoticed, forming a lens through which we see the world. When it comes to health, we are shown a narrow view.
This is your brain on drugs.
An apple a day keeps doctors away from...
I'm not comfortable with government-run healthcare.
And often, the field of public health has championed this too. That health is in our hands alone. That medicine and changing our behavior are the best ways to address health problems. That what we eat, where we live, and how we spend our days are free choices, and the only things that matter for health. But from this individualistic view, the ways we're told to be healthy are inadequate at best and harmful at worst, putting blame on our communities, who are already struggling because of multiple systems designed to harm and exclude us. When we as the public health community don't pay close attention to the stories we tell, we may unintentionally reinforce the very systems harming our health in the first place. Because the narratives we've been taught about our health have been created and reinforced by the same corporations and institutions who benefit from widespread illness and poverty.
So you can catch the rest of this video on the Health and Partnership YouTube channel. They have some other great resources there. But I think this does a good job of capturing what I was describing, which is understanding the narratives and worldviews of those who we serve, and understanding how to relate with people and putting that in a systemic context. And so what I want to then further dive into here is understanding how what we were just heard described, which is narratives and worldviews, plays out in terms of shaping communication. And these are 5 kind of key areas that we always need to be mindful of when we're thinking about drafting a message or connecting with people and having a conversation. That is knowledge, which importantly, it's important that we recognize is acquired through education, training, and lived experience. That research-based science or academic research is not the only way that we have knowledge, or that lived experience and expertise is just as important when we think about how we understand and make sense of the world. Our attitudes, which are ways of thinking or feeling that are shaped by our upbringing and experiences, and attitudes include the biases that we hold, and I talked about a couple of those. Needs, answering the question, what's in it for me? People have to see themselves in a problem in order to want to solve it. But again, I want to emphasize here that they also want to know what's in it for their group. And from a policy perspective, that's what we want to be mindful of. And then values, what matters most to your audience or what standards they hold. And then culture. And these are things like identity, religion, cultural practices, and norms that we engage in. I like this visual because we often think that if we lead with data, which I should put on the left side, the policies and procedures, strategy, and vision, that these are the ways that we get things done. And those are an infrastructure for doing things, for taking action. But really how we get things done is by shaping perceptions, traditions, norms, and values, and understanding how those things operate in the communities that we serve. And I really like this particular resource. This is Storytelling and Evidence-Based Policy, Lessons from the Gray Literature by Brett Davidson. This is a great kind of meta-analysis of what the literature says about how to do storytelling and engage in storytelling for evidence-based policy. And this is just one really great quote, but I think it's relevant to the current moment, which is some of the most important policy debates, particularly in deeply divided multicultural societies, involve decisions not only about means, but also about ends. These are questions of what ought to be, and they are questions of values, not facts. So we want to be speaking to the values, not the facts first. So the work that I do on communications in public health is based on moral foundations theory and values-based messaging. And so this comes from work that was done by Jonathan Haidt in The Righteous Minds, and he uses the elephant and the rider metaphor. And the elephant is our rational brain, and this is where we think that we make a lot of decisions from, but actually the little rider is our intuitive brain, and the rider is actually what directs the elephant. And so while the elephant may reason, the rider, the emotion, our intuition, our attitudes, the rider is shaping what the elephant does and how the elephant moves. And so values-based messaging is built on this idea that we have foundational moral values that resonate with all of us and that drive our intuitive brain, the little rider, and that we have to connect with these and other people in order to be more effective messengers. Those particular values are care, liberty, fairness, loyalty, authority, and sanctity, according to Haidt. But there are many other values. And one thing I would like to hear from you is, what do you think are important from a public health, important values from a public health perspective that resonate with you when you think about how you want to communicate with people about the work that you're doing? And I will say, while you're thinking of responding, care is something that resonates across cultures, across the world. Fairness, transparency, community is a value, and we can communicate with people centering the idea of community and connection. Trust, opportunity, accountability, positive, belonging. Sometimes people put justice, equity, equality, are also terms that often people suggest. These are all really important here because those are things that we can appeal to in other people. Freedom from disease, right? Freedom is an important concept because how we frame that can really appeal to how people make decisions about what their beliefs around freedom are shaped by. So if their group has a certain view about freedom, we can engage with that information to develop a message that appeals to how they understand what it means to be free. Same thing with these other concepts. Inclusion, yeah, so these are all really great examples. The one big takeaway from this that I want you to leave with is we're talking to, oh, it looks a little lower. We're talking to the rider, not the elephant. So I'm gonna go back and adjust this so you can get a copy of the slides. You can see that the talk to me is by the rider's head, but that's who we're talking to. We're not talking to the elephant. So there are a couple of other important things to think about when we are engaging in communication, and then I'm going to spend the rest of the time after this next couple of slides talking about examples of how to do that. But one is that we know that people can be persuaded, who can be persuaded, often hold beliefs from both the base and the opposition. And so it's important that we're able to speak to both of those things. So we know the base really well. We know public health really well. But do we understand the opposition points, and how intentionally are we engaging with information that helps us to understand the opposition? Because that's a way that we can reach this very large group of people, about half of people, according to some studies, who can be persuaded. And this is actually a great quote from Hidden Brain, which is one of my favorite podcasts. This is from the episode Success 2.0, The Obstacles That You Don't See. And it says, we are most effectively and profoundly influenced, not by ideas and data and evidence that people give to us or force upon us, but rather by ideas and evidence that we generate on our own. Now, this episode is great because it talks about a study that was done where smokers were exposed to messages that were anti-smoking and included information about the health risks of smoking. But they created a manipulation where in one case, someone read the script to them, and in another case, they read the exact same script themselves out loud. And what they found was, in the latter case, where they were reading the script out loud, people found the ideas more persuasive than when the very same evidence and data was read to them. So what do we do with that? How do you create the conditions to for self-persuasion, for people to persuade themselves? And one fundamental way that we can do that is start at a position of alignment. And again, this is where we connect with those values, beliefs, knowledge, attitudes, and culture, because we often begin conversations at a point of conflict, whereas like, you don't want to wear a mask. There's evidence saying that you should wear a mask. I would like to engage in a conversation about why you should wear a mask. But what we need to do is take a step back and have a conversation where we are aligned, and then find a place to start having a conversation about agreement on how to solve a problem. So that's where we start, is alignment rather than misalignment. And then the other feature of being able to engage in persuasion is not telling people what to think, but presenting them with information that helps to inform what they will think about themselves, much like reading the information about the anti-smoking campaign, but also asking them something like, are you open to another perspective? I remember this, I listened to this episode probably 4 or 5 years ago, but they call this a yes question, and that is most people will say yes if you ask if they're open to hearing another perspective. And so it's a great way to have an in to having a conversation to explore where you can align before you try to problem solve. So want to hammer home this idea of we are talking to the individual. People have to see themselves in the problem and in the solution, but it's not just that. It's also understanding what is in it for my group. And again, you have to be intentional about exploring who is the group or what is the group that they belong to? What are the beliefs and practices of that group? It could be multiple groups. But the other thing that I want to point out that's important when we think about groups is that groupthink, confirmation bias, and other biases can be overcome by creating new groups that have shared values and objectives. So one of the things that we can do in public health is try to create alignment around a shared vision for a healthy future, healthy community, tobacco policy, creating groups aligned around this shared vision and definition of health. So this again is from the resource that I mentioned called Storytelling and Evidence-Based Policy, Lessons from the Gray Literature by Brett Davidson. And this is what comes across in all the literature, identifying the policy issue, identifying and mapping the audience. And I've talked about that, but this is really where we go back again to the knowledge, attitude, beliefs, values, and culture. Selecting an appropriate messenger, recognizing that we in public health, our organizations, or maybe even as public health professionals, are not the best people to be leading with the message. And one of our roles being, going back to like that tobacco campaign, knowledge is power. How do we equip other people with knowledge so that they can go out and be the messengers? Getting the timing right, understanding the rhythms of the policy process, building relationships and networks, and mapping the broader political context. I believe now more than ever, building relationships and networks and fostering connection, really engaging in meaningful relationships with people before we take any action is critical to weathering the current cultural moment. Developing a theory of change, developing a communication strategy along with appropriate messages, and developing a clear monitoring and evaluation strategy. So I highlighted 3, the understanding your audience, having an appropriate messenger, and connection, because those are things that we can all do and adopt really easily in the work that we do. So here are some practical tips for how you can be a better communicator. And this is something that we all can do, myself included. But again, intentionally explore the knowledge, attitudes, needs, values, and culture that everyone brings to the table. This means you, because your own biases, knowledge, attitudes, beliefs, and culture and values shape the way that you run in the world, but they also shape your organization. Your organization has a behavior of its own. And then, of course, you want to understand the same perspectives of your audience. And going back to hidden brain, finding alignment rather than misalignment. We want to use tools and frameworks for our ideas on drafting and structuring your message. There are a lot of tools and frameworks out there. What you want to do is use what works for you. And this can be taking bits and pieces from multiple frameworks and using them to create resources that you can pull from when you're trying to put together a message or create talking points or otherwise engage in conversation. And then the 3 other important things I want to share are messages really need to focus on places, systems, or conditions, use asset-based and solutions-oriented framing, and use storytelling to connect and bridge. And there are lots of reasons that we engage in storytelling, but importantly, storytelling helps to build empathy. It helps us to strengthen the connections that we have in communicating with people. And stories help to illustrate behaviors that we want to see and the impact of behaviors. I like to think of this image on the right as being a clever illustration of people speaking each other's language. So orange is speaking to orange and orange is speaking to blue, blue is speaking to orange. But the idea is that we are trying to communicate with people that resonates with them, not necessarily only with us. So a more specific example of what I mean by focusing on systems, places, or conditions is that we want to emphasize the systematic and structural ways that inequities occur rather than say something that leads us to reinforce beliefs about individual choice and behavior. So one example of that might look like In the United States, approximately 58 million individuals who do not smoke are still exposed to secondhand smoke, including 15 million children aged 3 to 11 years. And you might say, that sounds really bad. We should do something about that. But some people might look at this and say, those people can choose where they hang out. They should just not be around smokers. And we have to understand that that's a perspective that people might hold. What we want to do is lead with what we want to see. Well, there is no safe level of exposure to secondhand smoke, but we're still exposed to smoking in public places and in shared housing. Smoke-free policies you can insert any kind of space here, multi-unit housing facilities, public parks, etc., are one way to create a healthy environment that eliminates or reduces exposure to secondhand smoke for everyone. So we're focused on the system, which is we need policies in place that support a healthy environment, and we don't want to draw attention to individual behaviors or choices. And let me just make sure. Okay, nothing in the chat for me. So the second thing is focusing on using asset-based and solutions-oriented framing. So one thing you might see, and this is a tobacco-specific example, is tobacco waste is a major public health and environmental problem. Cigarette butts are the most littered item in the world, polluting our parks, waterways, and other public spaces, and exposing people and wildlife to toxic chemicals. But when we take an asset-based or solution-oriented framing, we want to emphasize what is happening that is good. That is changing the policy environment, that is creating health. So communities across the country are taking action to create cleaner, healthier shared spaces by reducing tobacco waste. This includes adopting tobacco-free outdoor policies, expanding access to waste receptacles, and engaging with local organizations in cleanup efforts. Now, again, we're not talking about individual behaviors. So we want to say it's on residents to go out and do cleanups. We're saying here are the things that can happen in the systems that address tobacco waste, but also we can see what is happening that we might want to be a part of. So one of the things that is important about solutions-oriented framing is that it gives people a way to see how they can be involved and understand that the problem can actually be solved. So I'm going to walk through 3 frameworks that you can use that I think are very much aligned with what I've been telling you, which is find points of alignment, starting with shared values, to identify who your audience is, I state the problem, and then use asset-based and solutions-oriented framing. So what you'll see in these next three examples are reinforcing exactly those particular points of frameworks. So this is from a resource called the Message Development Worksheet by Berkeley Media Studies Group. And what they say here is name the problem, say why it matters using shared values, and then emphasize the solution. So this particular example is from tobacco control. And the problem is that tobacco companies are targeting consumers in our state with cheap tobacco products. Sometimes this is done through discount coupons and sometimes through financial incentives provided directly to the stores that sell cigarettes. Kids are especially vulnerable to these tactics since they have less money to spend. So the solution is restricting coupons and other promotions would go a long way towards solving this problem. The value here is that when we could do something to improve the health of the community, we have an obligation to do it. So this is appealing to the idea of care in some way, or fairness, or something related to responsibility or authority to take action. This is from another resource that's great called Tips for Communicating About Health Disparities from the Collaborative on Media and Messaging for Health and Social Policy. Another great resource for people who are very research-oriented to see current literature on communicating about health disparities and social and policy issues. But very similar framework: asset framing, systems thinking, identify policy solutions, and narrative communication. So here's that storytelling piece that I was leading with. And what they have here in this example is featuring personal stories as vivid examples to illustrate structural and systems level causes of disparities. Again, that's what I was saying about focusing on systems, places, and conditions, and using stories or narrative communication to demonstrate how both individual and collective efforts, as well as policy remedies, can successfully reduce disparities. The third example is from Changing the Narrative from Big Cities Health Coalition. And this, I hope you're starting to see a trend here. Start with a shared value, move into a positive vision and problem statement that is rooted in the specifics of place, race, and class, and end with a call to action and unity statements. So what does this look like? What can these frameworks look like with a real message? So this is just an example, and I will say it's not perfect. This is something that I developed, but certainly for folks who are experts in this space, you can find ways to tweak this. You can sub your own community info and data into this and adapt your message. But here's an example. Every New Yorker deserves the opportunity to live a healthy life, free from addiction and the forces that make it harder to quit. But in many communities, and here's where you might describe your specific neighborhoods or data about your state or data about your county, tobacco marketing and access have made that freedom harder to achieve. For example, tobacco retailers are more prevalent near schools and transit hubs. This access, combined with decades of targeted advertising and underinvestment in culturally relevant cessation programs, have led to preventable differences in health outcomes for New Yorkers across race, place, and income. Together, we can build systems that protect rather than harm by implementing policies that limit flavored tobacco sales, reduce retailer density in low-income neighborhoods, and expand equitable access to quitline and community-based cessation resources. Now, that was a mouthful. And I'm going to leave this up here for a second. And what I would like to ask you is, when we think about problem solution values, what stands out to you, particularly on the values piece? Like, what do you think is being appealed to here in this message? Freedom. Yes. Fairness and equity. Freedom, right? Freedom of choice about the spaces that we live in, about creating a choice architecture that allows us or gives us the opportunity to make choices that are healthy. Access, making communities healthy for everyone, healthier for everyone. And so that's an important, emphasizing connection. Again, right now, the current cultural moment needs more connection and more care. And research shows that messages that appeal to care and fairness are messages that have broad appeal. What else stands out to people, or what does this example make you think of? And then we'll move forward and wrap up, actually. Start to wrap up. The word together. Yeah, and that appeals to our sense of connection and care for the people who are in our communities, in our neighborhoods. The other thing is, like, these have very specific policy recommendations that are relevant to New York, but you can sub in what is your organization currently working on, put those policies in there, and make sure that people can draw the connection between those policies and a cleaner environment, less opportunity for addiction, less access to tobacco for kids, et cetera. Support, addressing historical inequities, right? So that goes back to the systems, places, and conditions framework, which is saying, like, we don't want people to think about individual choice. We want people to think about a system that was designed to target certain people and get certain people to engage in smoking and then make sure they keep smoking. Should be emphasized more. All members of a community get to determine what their communities look like, have higher quality, et cetera. Yeah, everyone has a voice. And when we find points of alignment, we can have a conversation about what our shared vision of a healthy community is. So thank you all for engaging on that. So this is just a recap of what we were talking about, which is understand your audience, use the tools and frameworks that are out there. After this, I'll make sure that there is just a one-page resource list of the things that are in this presentation, but I know you'll also get the slides. But there are lots of tools and frameworks out there. So use them, take what works for you. Break your message into smaller building blocks, and then you can do something like mix and match your phrasing, and I'll show you an example of that. So create a repository of messages that are aligned with what you're trying to accomplish, but also you can tweak them based on what you understand about your audience, so what they value and how you might change your language based on that value. You should contextualize examples using specific local data, demographic stories, and place-based narratives. Use relational or caring language and incorporate other values that will build and strengthen connections. Right now, going back to the current cultural moment, I really believe that now is an opportunity. Now is an opportunity, an inflection point for change. Much like you saw those other big public health events were major inflection points in creating a cohesive or divided culture. And I think now is that moment, and we can advance better policy, and we can support democracy, and we can improve the health of our communities by having stronger connections and finding ways to demonstrate care, not just in the way we interact with each other, but in the way that we design and implement policy. Help people to see the solution and see themselves in it, and finally, test your message and use your findings to improve it. We didn't talk about that a lot, but that is an important piece of this, is that you're constantly evolving your messaging and making tweaks to make sure that you are relevant, culturally appropriate, and making sure you're advocating in a way that people can respond to. And let me just check. I did see the chat. Okay, oops, sorry. So this is one example of shifting language, create your own phrase bank. So I'm not going to go through all of these. And I actually really hesitated to share this particular slide because I don't want people to think that this is the be all and end all ways of changing your language or shaping your language. And you may even disagree with even changing your language. And there is a lot of debate about whether we continue to do things like say and name racism versus whether we find alternative language, and what does it mean if we find alternative language, right? And if we go that route. That is not a debate or conversation for today, but what I want to suggest here is that if you're in a position where this is a thing you have to do, you can create a list of the words that you normally use, and then find alternative phrasing. So, one thing might be, instead of at-risk individuals or vulnerable populations, you could say people facing greater exposure or barriers. You can talk about people who have been historically excluded or marginalized, or communities that have been under-resourced. Because the reality is that some of us work in environments where we have to make these kinds of changes and shifts. But the big message and takeaway from this is that it's important that you ask other advocates, policymakers, and impacted people how they talk about these issues in their communities. One very short story, I was at a conference and it was on behavioral health, and there was an advocate on peer support workers in addiction recovery. And one of the people on the panel said, I don't go to my doctor and say, I need help with my social determinants of health. And I never forgot hearing that, because we talk about we use these terms, we use this language in public health settings, but I don't know that we do as great a job of engaging with people using language that resonates with them in everyday conversation. So think about if you're sitting on a bus or a plane or other public transit space next to someone you've never met before in your life, and they're like asking you to explain what you do. Can you do it in a way that doesn't use terms that they may not be familiar with? So that's one big takeaway from today. I like this. This is another great resource. This is Frameworks Institute, Reframing Public Health Informatics. So people who work with data a lot, but there's lots of great tips in this resource for everyone. And the reason that I share this is because I think this perfectly illustrates kind of the nutshell of what this talk is about, which is making sure that we are finding ways in that blue circle of change to communicate in people's language, to understand them, to understand their values, to change our language and change the way that we engage, to recognize that we want to be coming at things from that perspective, or at least acknowledging and identifying that perspective as we engage, translating, if you will, the green to the purple, translating our information in a way that people will respond to. So with that, I know we have time for questions and comments, and I want to again thank Colleen and the Public Health Law Center for the opportunity to share this. I could talk about this all day. I will just say that I would love to connect with you. I am on LinkedIn and I am on Instagram, and I am very active there and respond to messages, and would love to hear from you and share more information on anything that you heard today.
Thanks, Dawn.
Thank you.
That was great. And we have some great questions too. So let's dive into the questions. First one, what are some tips for communicating with decision makers or an audience that may not agree with you or may not prioritize public health? What's a good way to start those conversations?
Yeah, I would go back here. That's a great question. I would go back here to the idea of finding points of alignment. So if you say, like, we have a disagreement on a policy, well, do you understand what those disagreements are? But have you also intentionally made a list of identifying where you do have agreement? Or even within a disagreement, is it just a matter of seeing things differently. So one example, when you think about a concept like fairness, is that fairness can be about equality or fairness can be about proportionality. And so depending on your political leanings, you might think that fairness means that everyone gets what they deserve, even if that means that some outcomes are unequal. Or you could believe that fairness is about equality and that everyone should get, not that necessarily the same thing, but everyone should get things that support them to live their best life and that we're aiming for equal or equitable outcomes, right? But that actually is very different based on political leaning, how we define fairness. So understanding where you have points of disagreement and exploring what is that disagreement rooted in, and maybe there is where you can start your conversation. I would also say, like, find something that is maybe unrelated where you do have alignment as an in to having a conversation with that policymaker. Was that the whole question, or was that just the first, did I miss part of it?
That was great. I have a related one, but that
Okay.
was, yes, that was the whole question. Okay, the next one. How do you address counter arguments that seem either really incorrect or insincere? So one thing we see sometimes is that people will not be clear either with themselves or in the way that they're communicating about why they oppose a policy. For example, maybe they argue that they lack legal authority to do something, and that is not correct. How do you argue or counter that, interact with that?
Yeah. How do you, well, first of all, isn't this a struggle sometimes? I mean, for anyone, no matter what your beliefs are, it's a struggle when you encounter people who say something and you're like, that's not true, or that's not accurate. And they are very entrenched in their beliefs. So one thing that is important to do is not give them counterfacts. I certainly don't lead with that. And so one thing that's important to remember is that we don't convince people whose beliefs are not based in evidence by giving them more evidence. So don't do that. What you should do is be curious. That's actually a great communication tip overall. Ask questions, understand, ask them to explain what their opposition is rooted in. Ask them to explain what it is they value. Ask them to explain how they arrived at their position, right? So like getting a little bit of a root cause analysis on how they arrived at this really entrenched belief. And remembering importantly that you are not talking to people to change their mind necessarily. Like you're giving people information and you're giving them the space to persuade themselves. They may or may not do that, but we have to accept that some people may not be persuaded and may not change their minds. So if you go into communication thinking like, my goal is to make sure that you have information or ideas that you need to make an informed decision, what you do with that is your choice. And so keeping that in mind when we give that, I think that helps us to think like there are some people we're not going to get convinced, and that's okay. But did we do our part to engage and understand what really underlies that belief?
Great, great. That's a great point about curiosity. Okay. The next one is a problem we struggle with for our statewide campaign is that we want something that all programs can utilize and share with the community, but we also want something that is pointed and focused on a singular problem. This applies to a lot of public health messaging where health departments and CBOs have limited resources and want to reach as many people as possible, but then specific problems affecting specific communities get lost. So those goals of trying to reach as many people as possible, but trying to target a specific problem are at odds. Do you have any suggestions for that?
Yes. So this goes back to the idea of the repository. So one of the things that you can do is create, and one of the resources that I'll share with you does this, is create a repository of information that everyone can use to frame their message, but give specific prompts to say, here's where you fill in information about your community. And I gave that on that example of using kind of New York, here's where you can fill in information about your community. Here's where you can put local context. Here's where you can put policies that are relevant to your local community while still providing language that everyone can use that helps to frame the overall policy issue in the broader context. That is what I would do. Is that work? Yes, but what ultimately it does is it gives people alignment across the policy messaging, which is advancing these bigger picture policies, but also allowing them to adapt and contextualize it for their particular setting.
Great. Okay, and this might be a little bit similar too. How do we frame our messaging for the different environments where public health is active? For example, I don't use social determinants of health at my state legislature, but to me, it's okay at the School of Public Health.
Yeah, I think you do exactly that. you use the language that resonates with the people that you're working with. Now, this is my personal opinion as a communicator, but there are people who believe very strongly that we still use the language of social determinants of health, of racism, of health equity. If that is your belief, do that. Recognize, though, that that can be alienating, and from a policy perspective, if you're turning off somebody because of the language that you choose to use, you're cutting off your own opportunity to advance something that will improve people's health. So is there a way that you can use language that you are comfortable with that also still gets the point across? So that's a great example. Don't use social determinants of health with your legislator. What do they care about? They care about finances. They care about the fiscal impact. They care about the impact to their constituents. Use those as points of leverage when you're having a conversation that is something that is going to address a determinant of health. Put it in language that they can understand and relate to and be open to.
Great. All right. Well, you were able to answer all of the questions we received so far. I'm sure you will receive some follow-ups. Thank you so much for joining us, Dawn, and for this great information. That was excellent. And I think will give all of us lots to talk about and think about. And we really appreciate your time and being with us today. Thank you so much. And thanks everyone for joining us. And please feel free to reach out to Dawn and also to us with any questions that we can help with.
Thank you again. And thanks everyone for engaging in the chat. I appreciate it.